Pfizer's COVID-19 vaccine has arrived here in Canada, and people right here in Toronto have actually received the vaccine. And this should all provide hope to us all and help to encourage us to continue to do the right thing to stop the spread of this virus as much as we can until it comes our turn to be vaccinated. It also reminds us that our work to help people get through this can't stop, nor can or should there be any let up in our own personal adherence to public health guidelines, a subject to which I'll return in a moment. Chief Pegg will also provide a high-level update today on the city's work on vaccination preparation. We had a good meeting on Sunday on this important planning work, and while the province is entirely responsible for the first doses of the vaccine here now, we are working, the city and Toronto Public Health, working with the province and everybody else to make sure that we are ready when it comes time for inoculating the general public, and we stand ready to help with these early efforts if requested to do so by the province. While our city government has been focused on our ongoing response to COVID-19 and to making sure that we're doing everything we can to help protect people's health and save lives, we've also been continuing to make progress on the initiatives that were underway before the pandemic to improve the quality of life in Toronto. You'll remember that I launched the Tenants First initiative so we could transform Toronto community housing and deliver better service to the residents, including and especially those seniors who call TCHC home. Part of the Tenants First plan is to ultimately create a separate seniors housing organization that will focus entirely on seniors and making sure they have the services they need. I'm proud to announce today that Toronto Community Housing has begun implementing the integrated service model for seniors housing. This is a major step forward in seniors housing and making sure that we do it right. The model will support senior tenants to age in place, have successful tenancies with TCHC, and enjoy a better quality of life. That is what our seniors deserve, all of them. TCHC Senior Housing Unit will be the first to implement this model in 18 buildings in the southeast area of the city. The model has been designed and developed by the city and Toronto Community Housing with input from the Toronto Central Local Health Integration Network and with senior tenants. Implementing the integrated service model was a key deliverable of the Tenants First plan. The model will provide the improvements that seniors living in Toronto Community Housing have told us they want and that they need. It will deliver services to seniors in ways that meet their specific needs, and more importantly, it will build relationships of trust between housing staff and the senior tenants they serve. Once fully implemented by the end of 2022, the model will support better housing for more than 14,000 low-income senior tenants aged 59 plus living in 83 senior designated buildings across the city. The model improves service delivery and increases access to health and community support services by having more of those services being delivered by community agencies right in the TCHC seniors buildings themselves. It builds partnerships that make sense. It increases staffing levels at seniors buildings and updates policies and procedures to make sure they focus on priority areas for seniors. The model will introduce seniors' health and wellness hubs in selected buildings, the hubs being staffed by health and community agencies, and they're a place where senior tenants and other seniors living in the community can access particular services that seniors themselves need. Designated care coordinators will be located within TCHC seniors buildings, and these care coordinators are aligned to City of Toronto neighbourhood teams and will work with TCHC staff to ensure senior tenants can access the health supports that they need. We will measure this to ensure that our senior TCHC residents are receiving the care they need much closer to home. This is a major step forward for both TCHC and its senior tenants, and I'm glad that we can provide this additional help for people. Now, on another note, quite different than that, I should tell you that our outdoor ice rinks have been open for 2 weeks now while observing all of the COVID-19 safety protocols, including by-appointment skating. It's interesting to note that more than 107,000 people have booked time to skate on the 54 rinks across the city, and they have been following public health advice to exercise safely outdoors. Starting today, leisure skate times can be reserved up to 7 days in advance at outdoor rinks, which is a further way of making it convenient for people, but also helping to manage the flow of people to and from these rinks. I want to thank our park staff for working to make this possible, making it possible to book an appointment up to 7 days in advance. It's something that makes sense that you'd be able to do online, and I'm glad that we're able to provide this additional feature to people across the city. My remarks for today would not be complete without reference to some of the flagrant examples of non-compliance with public health guidelines we saw this weekend, actions which go against all of the efforts that we're making to fight COVID-19. While I know that the vast majority of people are doing their best to follow public health guidance by staying home and not socializing outside their household and by wearing masks, just to cite 3 of the most basic of rules, there have been some particularly appalling examples of non-compliance that are worthy of some comment today. The notion that anyone would operate a bar-type scene, apparently well outside of the bounds of the law, such as alleged on Queen Street West, represents the height of irresponsibility. The police were refused entry for an extended period of time when they came in response to complaints, and when they finally got inside, they found a crowd scene with no one wearing masks. I would like to think this was an isolated incident which will now be dealt with by the court system, where I can only hope that the full weight of the law is applied to this kind of irresponsible behavior. I want to repeat something I said on the weekend which resonated with many people based on the emails that I received. From Friday through Sunday, in the city of Toronto alone, we lost some 14 people to COVID-19. 14 people died, mothers, fathers, grandparents. I ask those who are not taking this as seriously as they might, or who know someone who's not taking this as seriously as they might, what would they be thinking at this moment if I was sitting here as mayor telling you that 14 people had been lost to fire deaths, or 14 people had been lost to criminal activity, or to collisions involving cars and pedestrians and cyclists? The reaction, I would think, would be quite properly swift and demanding of better from all of us. Well, the fact those 14 people died over the weekend from COVID-19 is no different. 14 Torontonians are still gone, and the answer to getting this number down to 0 as we go forward rests with us, not with the government, or with the Premier, or with the Mayor, or with the Medical Officer of Health. It rests with us collectively, all of us, without exception. We will either decide we're going to follow public health advice and comply with the guidelines and other restrictions that have been placed upon us, or we won't. And this will become even more crucial over the holiday period, when we'll have family traditions that will be upended and more people with more freedom, because many will not be working, at least not continuously, over the course of the holiday period. So I ask you to remember the people who we lost this weekend and the hundreds that we'd lost before that since the onset of this pandemic, when you are considering what you will be doing today, and especially going forward into the heart of the holiday period. I would now like to ask Dr. Davila to provide her report for today.
Thank you, Mayor Tory, and good afternoon. I'm reporting 638 new cases of COVID-19 today. 288 people in Toronto are in hospital with COVID-19, and 74 are in the ICU. Since I last reported to you last Wednesday, Toronto has seen almost 2,800 new cases of COVID-19 and 181 people admitted to hospital. In this context, I want to talk first about schools to reassure parents as best I can. I know it is worrying to hear about additional school closures, even if it doesn't affect your school. We have found that when an outbreak is linked to a school, since the start of the pandemic, it involves, on average, about 5 cases. I hope it provides some measure of confidence when I say at present the total number of schools closed is 13. While 1 is more than anyone wants, 13 is the present total out of roughly 1,200 schools in Toronto. We have acted to close schools where it was needed and worked to ensure the hundreds of schools still able to be open are open safely. But as I have said before, while we support schools open, it isn't at any cost. Everyone involved in the decision-making process is paying very close attention to schools and has been since well before school returned in September. We will continue to do so this week, this winter, and until COVID-19 is under control, because safely operating schools is, in principle, good for children. Safely operating schools also provide a support to single-parent families or families where both parents have to work, particularly when their work is an essential service, which can be anywhere from the healthcare system to the food supply. COVID-19 in schools is reflective of the rise in infections in the community, where children spend the majority of their time. We continue to find that when a student has COVID-19, most often the infection happened outside of school, not at it. We must all be careful, but we need not be fearful. It is important that in prioritizing the safe operation of schools, that we're also prioritizing safe choices and behaviors in the community, because community has a direct impact on schools. In that respect, the facts tell us again today that we cannot celebrate in December like we would in any other year. We can't invite people into our homes who don't live in our homes with any certainty that we're safe from COVID-19. The totals for December so far are just over 8,000 cases of COVID-19 and 364 hospitalizations, just 14 days into this month. Please remember this and act to protect yourself and everyone else, particularly in the next few weeks and in the coming months as well. The good news today is that the first vaccination has now officially been delivered in Ontario. There seems to be new news about vaccines every day, and after all these months, enormous interest in it. After so long, it is a great thing that our hopes about vaccination have turned into justifiable expectations. The province is managing the vaccine rollout and is laying out the plan for managing vaccine administration in the next few months. It is a three-phase plan which initially prioritizes healthcare workers and the people who are most vulnerable to COVID-19. I hope everyone will take advantage of the opportunity to be vaccinated as vaccines become available. So finally, it's COVID-19 on the defensive and not us. About 70% of the population will need to have been vaccinated to make the kind of difference that will make life feel more normal. But for many months to come, even as more and more people are vaccinated, we will still have to rely on the steps for self-protection that are our best defense against COVID-19. Consistent mask wearing, avoiding crowds, limiting contact with people we don't live with, keeping a safe distance from people we don't live with, washing hands frequently. As vaccines are rolled out, we will need to be patient, careful, protective, but also justifiably optimistic. While the province manages the early phases, for Toronto Public Health and for me, the job remains to keep everyone focused on protecting themselves and acting to limit further spread of COVID-19. A resolution to this crisis is coming, though definitely not in time for Christmas or any other December celebration. This year, there's much we can't do if we're to keep in good health keep those we care about in good health, and keep COVID-19 from getting any worse than it already is. But there is still a lot we can do under the circumstances. We can get together through our computer screens. We can pick up the phone. It might even be a good year to revive the fading tradition of sending cards. Write in a promise to get together next year, when we can hopefully look back and see how the sacrifices we made were worth it. With that, I'll now turn it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila, and good afternoon. The enforcement of public health-related regulations has been a top priority for the City of Toronto since the outset of COVID-19. Our coordinated enforcement teams have been working diligently to enforce the regulations relating to COVID-19. This includes proactive inspections, responding to complaints, educating the public, and when necessary, issuing tickets and laying charges against those businesses and individuals found to be in violation of the law. The City has taken formal enforcement action 1,723 times to date in response to COVID-19. This weekend, our enforcement officers continued to monitor compliance with the Reopening Ontario Act. 159 bars, restaurants, and other non-essential businesses were inspected over the course of the weekend, resulting in a 96% compliance rate. A total of 6 non-essential businesses were found to be in violation by the investigating officers, with 6 charges being laid under the Reopening Ontario Act. I'm pleased to report that our enforcement teams did not observe any violations during shopping mall patrols this weekend. 6 charges were laid by Toronto Police under the Reopening Ontario Act as a result of the investigation of complaints relating to gatherings on private property over the course of the weekend. We did not experience any significant issues in Toronto parks this weekend. I want to thank the vast majority of residents and businesses who continue to help stop the spread of COVID-19 in our city. Your actions are helping to save lives, prevent the transmission of COVID-19, and helping to prevent our healthcare system from becoming overwhelmed. Our City of Toronto Immunization Task Force continues to be hard at work as we prepare for the launch of the COVID-19 immunization campaign. The Government of Canada is responsible for approving, procuring, and distributing COVID-19 vaccine to the Province of Ontario. The Province of Ontario is responsible for receiving all COVID-19 vaccines from the Government of Canada, including the most recent shipment, and for distributing the vaccines across the province. The province is also responsible for establishing the vaccine distribution priorities and for the actual delivery of the vaccine during what they describe as Phase 1 of the immunization campaign. I'm pleased to see that the first vaccines were administered in Ontario earlier today. Our teams are working in support of the Province of Ontario as they plan for and launch the first local vaccine administrations via the University Health Network. Once the City of Toronto is provided with COVID-19 vaccines by the Province of Ontario, we will begin the administration of these vaccines in accordance with the prioritization framework that will be provided by the province and under the authority of Toronto Public Health. We continue to be directly connected with the Provincial Immunization Task Force and are working together to ensure an efficient and effective administration of vaccine for Toronto residents. I'm also pleased to advise that we are in regular contact with a number of our large urban city peers as we all work together to plan, respond, and learn from each other. We have now set up recurring meetings that include key COVID-19 operations leaders from Ottawa, New York City, Chicago, and other metropolitan areas from around the world. This is an important and growing network of leaders who are committed to doing our collective best to respond to the global COVID-19 pandemic. As always, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. We'll go to questions. Just a reminder, reporters, to please unmute yourself before you ask your question. And first, we have Mark McAllister from City News. Mark, go ahead. Mark, you need to unmute yourself.
My apologies.
There you go.
Dr. Davila, you spent some time speaking about schools and the closures. Wondering, going into this holiday time, how do you go about monitoring the cases once schools are let out prior to coming back in January, so you know where you are in terms of the situation, the number of cases, and how many schools might be threatened as a result?
So that's an excellent question, Mark, and I think it first starts off with getting notified through the laboratory system when there is a positive COVID case. And as is the situation with every positive COVID-19 test we get, we follow up with that individual, and in the case of children, it becomes patently clear from the age of the patient that we're talking about somebody who is school age. And in the course of that case management, we have the opportunity to discuss generally with the parents, what the circumstance is. What school does the individual go to? What grade? And we can start to follow the case from there and determine what next steps are, premised on that case investigation and understanding what the circumstances are, whether there was an exposure at the school, etc. But it all starts with case management, as every situation does with COVID-19.
The question's been brought up in the past. I'll ask you again. While it is the province's decision, what's your position on delaying the return as a result of the possible increase in cases through the holidays?
Mark, I think we have to look at, every decision that we make based on the circumstances that we have in front of us. Certainly, I'm hoping that the residents of Toronto will continue to follow the advice that we've been putting out there and limiting their interaction, as challenging as it is over the holiday season and as much of a change as it is from what we want. We do hope that people will follow our advice and limit their contact to the greatest extent possible, really focusing on keeping their close contacts limited to those with whom they live. So certainly that will be a first step to all of this. There continues to be active conversation amongst all the partners involved in the decision making around schools. I know that the team at Toronto Public Health that's directly involved with our school boards is in daily communication with our school board partners, and in turn, our school board partners are liaising with the Ministry of Education. There isn't a decision that's landed yet. We believe that it's best to make the decision that makes sense when we have the circumstances in front of us and understanding what our current situation is. That's how we make decisions within the realm of public health. We look at our data, we understand what's actually happening locally, and make the decision that makes sense at the time.
All right, thank you. We'll go next to Matt Bingley from Global News. Matt, go ahead.
Hi, good afternoon. Dr. Davila, you talked about that 70% herd immunity target with vaccinations. I'm just wondering, when it is combined with 20% of the population who are vaccine hesitant and the other harder to reach areas of the city that we saw when it came to testing, how concerned are you about actually reaching that 70% target within a reasonable time, and what can the city do to actually ensure that is actually sped up?
I think we are still dealing with a new disease and a new vaccine, so it's hard to predict what exactly will happen. Clearly, we're interested in ensuring that as many people as possible actually take up this vaccine. It is, I can't overstate this. When you think about the remarkable achievement that has happened, we discovered this virus in January of this year. Here we are in December, and we actually have a vaccine against that new virus being administered, not even within the space of a full year. To my mind, that is unbelievable, and it is a remarkable achievement of science. Now it is on us, right, as local public health, in concert with many other partners, to do the best we can to encourage and educate members of our public so that they can take advantage of this really remarkable achievement of science in order to protect themselves and to protect our community and to restore, to a certain extent, as best we can, life so that it's more like what we once knew it to be pre-COVID. So I think there's a lot of work that has yet to be done. It is difficult to predict in advance or to state with any degree of certainty that this is the path that needs to be taken, or path B is the one that needs to be taken. We are very much learning as we go, given that we're talking about a new virus and a new vaccine. But I think that there is a lot of cooperation and collaboration, and it's that kind of cooperation and collaboration that has brought us a vaccine so quickly. And my sense is it's that kind of cooperation and collaboration globally that will help us figure out the implementation challenges that may arise as we seek to put this vaccine out there.
And just to follow up with, with Chief Pegg, I'm wondering what resources, aside from the vaccine itself, that you would say that you would need from the province to make sure that you're able to reach some of these harder to hit areas when that distribution of the vaccine is more widely available to the greater population?
So first and foremost, you hit the nail on the head. Obviously the kind of goes without saying, the most important commodity, if you will, that we're awaiting from the province is the delivery of the vaccine. From there, really, it comes down to very clear and concise information with respect to what the distribution priorities will be and in what order, and obviously as specific as possible. From there, it really just, from my sense and in the conversations I have with General Hillier and his team, it will be about staying directly connected and continuing to ensure that we're able to address any issues that may arise on a lifetime basis. I have every confidence that that will be. Our teams are hard at work looking at every possible facet, every avenue that we need to address, from facilities to transportation to planning to security and safety and all of the other myriad of things that go into a successful campaign like this. Those plans are well in hand, and I have every confidence that we'll be ready to deliver it without any delay at the point when the province can deliver vaccine to us.
Okay, thank you. We'll go next to Haley Cooper from News Talk 1010. Haley, go ahead.
Excellent. Thank you so much. My questions are going to be for Carlton Grant. Regarding Adamson Barbecue, Section 22, the Section 22 order under the Health Protection and Promotion Act has been lifted, but can you please clarify if the owner can now open for takeout, delivery, or drive-through, or does the owner have to keep his Etobicoke and Leaside locations closed because he still does not have a proper business license?
Okay, we'll go to Carlton then first, and perhaps Dr. Davila can add to that. Go ahead, Carlton.
So, Haley, thank you for the question, and I can advise that both Dr. Davila and myself sent letters to Adamson Barbecue this morning at 9 a.m. advising him of what he is required to do. Mine was fairly stern, requiring him to get a business license at both the Etobicoke and the Leaside location, particularly Etobicoke one before reopening. So, having said that, I'll turn it to Dr. Davila.
Yes, and so I'll add that, Carlton's quite right. I did send a letter to the owner of Adamson Barbecue indicating that the Section 22 order had been lifted. That is in relation to public health risks and a communicable disease risk in particular, because the conditions that necessitated the order in the first place are no longer present at the time, or at this point in time, I should say. There is no need for the order right now. However, that doesn't mean that there aren't other rules that need to be followed, one of them being obtaining a license. And that has nothing to do with public health, but other rules still apply, and the expectation is that businesses will comply with the other rules that exist, and that there are other mechanisms to deal with non-compliance with those issues.
Thank you. And my follow-up question is also going to be for Carlton Grant, and Mayor Tory, you may want to jump in on this as well. But So from what I'm getting from your comments, Carlton, the owner has not applied for the proper business license yet for both his Etobicoke and Leaside locations. Where do things stand as far as the communication you've been having with the owner? Does he seem open to applying for that business license? And if he does go rogue again and opens up, will he be permanently shut down by the city?
So again, Haley, thank you for the question. In most cases, as part of good customer service, we want to work with people to get them licensed. In this case, we are being explicit on what is required. It is a requirement to be licensed with the City of Toronto. Again, we've sent a letter today, a strong letter advising them that they need to reach out to our business licensing office and get the appropriate license before they reopen. Again, that's for the Etobicoke location, and we're also asking for the same things in Leaside. The failure to do so will result in enforcement and will result in us seeking a closure order.
And Haley, I will just say that I fully support the actions undertaken by Carlton Grant and his team. This is a person who's been a repeat offender in this area, and when you're a repeat offender, then it is necessary that more severe consequences should befall you if you continue to offend. And I think that's, Mr. Grant has indicated we're going to be watching this very closely, as well should be the case. So I fully support what he's doing in this regard.
Okay, thank you. We'll go next to Francine Copen from the Toronto Star. Francine, go ahead.
Oh, hi, good afternoon. My question is for Dr. Davila. Understanding that schools are a provincial responsibility and ultimately the decision will be made at that level, what's your current advice to the province at this time? Are you recommending that, or do you think that schools should close earlier, sometime this week? And do you think that they should resume later at this point in time? Is that your thinking, your personal thinking?
So Francine, at this point in time, my personal thinking reflects the assessment that's been conducted by the team at Toronto Public Health that has more direct contact and interaction with what is happening at schools. And there are certainly outbreaks, active outbreaks happening within our schools at this time. And as I've mentioned today in the remarks, we have 13 different schools that are actually dismissed, closed effectively because of COVID-19 activity affecting those schools and their communities. That is in the context of 1,200 schools, roughly 1,200 schools in the City of Toronto. And at this point in time, what we are continuing to find through our investigations is that when we are finding COVID-19 cases, positive cases of COVID-19 in our student population, it is still largely due to COVID-19 being acquired outside of school rather than within it. This being said, we are constantly monitoring. I can tell you that the school team at Toronto Public Health, whether it's the investigative side of the team or the team that is more on the liaison side and that talks about the education and the infection prevention and control, all parts of our team working in the school communities, they have just been incredibly busy, informing the schools, conducting investigations, following up on cases, investigating cohorts, conducting assessments, participating in testing pilots, etc. And they're advising me now that at this point, we can stay the course for this week. As situations come to our attention and as assessments determine that there is further action that's needed, whether it's certain cohorts being dismissed or an entire school that needs to be dismissed, they will make the decisions premised on the specifics of each and every circumstance. This is the kind of decision making that has served us well thus far throughout the pandemic, making decisions informed with the data that we see at the time and the circumstances as we see them before us. This is, again, the kind of decision making that has served us well thus far, And I suspect that it is going to continue to serve us well on the go-forward basis. So that will be the basis on which we contribute to any conversation as to what's happening within the schools for the go-forward.
Thank you. A follow-up question. You touched on the reasons why keeping schools open is good for single and working parents, but why is it important for kids that schools remain open?
There are many reasons, Francine, for that, clearly. Certainly part of that is academics. We know that it is much easier for the children to engage with the material and to really get the benefit of the learning and the academic environment by actually being in school in person. But as well, there are social and developmental benefits associated with being in school. There are mental health benefits in being able to connect with other people in person. And for a number of children in our community and throughout the city, it is also the venue at which by which they get access to a variety of services. For some children, it's about food. Access to nutritious food is actually provided through school nutrition programs. For other children, it may be healthcare related services or other social services that are provided and accessed through the school community. So there are a myriad of benefits associated with having schools operate in person. But the key, of course, is that we want to make sure that our schools are operating in as safe a fashion as is possible. Schools being open is a good thing for kids, for their parents, and for our community as a whole. But it should not be done at any and all cost. It must be done in a manner that promotes the health and safety of the children at the schools, of the staff that work at those schools, and ultimately what that means is community health writ large.
Thank you. Final question is to Nick Poivert from CBC News. Nick, go ahead.
Thanks. Mayor Tory, a question for you about council and your meeting this week for the last time of 2020. I'm wondering if you can just give us your assessment on how council has performed given all of the upheaval and difficulties with the pandemic this year, and maybe the praise the city has gotten for speeding up certain projects. Do you think there's an opportunity to continue some of that kind of work when the pandemic is over?
I think, first of all, that council has been terrific at standing beside Dr. Davila, Chief Pegg, and myself as the three people, together with the city manager, who have helped, and Councillor Cressy as chair of the Board of Health, in standing beside us as we dealt with some very difficult, very complicated issues, and they provided all the support that was needed when it was needed. I think they have as well been willing to join me in collaborating with the other governments to do the kinds of things we needed to do in order to produce equity and effective results across the city. So I think the council has functioned well. In the meantime, we've carried on, if you look at the proceedings of council, with a lot of the business that moved forward our plans on affordable housing, on transit, and different matters like that. With respect to our ability to continue to transform and to innovate and to do things, both during the remainder of the pandemic and after it's over, which hopefully is very soon, I think that we've proven we can work together. I think that we've proven that actually during the whole time that I've been here, 6 years, that we can work together. That yes, there are vigorous debates, but that in the end we've got a lot accomplished because we've decided we're not going to let polarization and division take hold of this place, and we'll continue to do that on the big issues, which now I think continue to be, as the pandemic hopefully recedes, affordable housing and supportive housing, transportation and transit, and I think back up to the top of the list for me is the economy and the finances of the city, just because you need a healthy economy in order to finance and keep the city successful and prosperous.
Thanks. And a follow-up on a different topic, if I can, as for a colleague of mine, and this is for Chief Pegg as well as Mayor Tory. Can you confirm that Bar Karma is the bar that hosted a party over the weekend? And can you explain a bit more about how the city is going to crack down on people who continue to violate some of these COVID-19 restrictions?
I can start and then leave to Mayor Tory. To be very candid, I don't know the name of the bar that was involved. That's not a level of detail that's provided to me, simply because generally speaking I don't need it. With respect to go forward, we, as you've heard me say throughout, our coordinated enforcement teams are active each and every day and each and every night on a 7-day basis. We continue to receive complaints and they continue to respond to those complaints, and I have certainly every confidence that that is exactly what we will see continue. Our enforcement teams, including of course Municipal Licensing and Standards, Toronto Public Health, and our colleagues at Toronto Police, were engaged. As you heard in Mayor Tory's remarks earlier, that involves some difficult situations like this particular one. I think they responded well. They've dealt with it appropriately and have taken the appropriate enforcement action under the law. Mayor Tory?
I would just say I didn't know the name of the bar either that was involved. I had asked for it this morning but hadn't yet received it. I will say this. I would just hope that, the law is the law. The law is the law, and those people obviously had no regard for the law, any different number of aspects of the law. And I would just hope if they don't care about the law, I don't know why that would be, but if they don't care about the law, maybe they would think about the 14 people that died of COVID-19 over the course of the weekend in the city of Toronto and the hundreds of other people who got sick, some of them sick in a way that will do damage to their health for the rest of their lives. I'd hope they might just think about that for just 1 minute before they start hosting parties and people not wearing masks anywhere in the city. So that's all I would say to them and about them, and I'm glad our law enforcement people got in there and issued some summonses, and the courts will deal with the rest of it.
Thank you, Mayor Tory, and thank you for joining us. That concludes today's briefing. We'll be back here on Wednesday. In the meantime, please stay well.